Hey guys, Kim here, and you are tuned into Kim E, the Diabetes MP, a place where providers can learn more about diabetes education and management through the lens of culturally responsive care, preventative care, and patient engagement. We are now coming to the end of Black History Month. We are in February now, and I make it a habit to bring extra awareness to Black communities in healthcare. Throughout this month, we have discussed the diversity that is within the Black community, so you're able to better individualize care. You can do that through addressing SDOH. And today, we're going to talk about our verbal and nonverbal communication and how to avoid dismissive behavior when you are communicating with your patients. Now, let me just go ahead and say this. This is not something that's exclusive to the Black community, to any marginalized group. This is something that we should be practicing with every patient that we have. And if you've noticed throughout the month, pretty much everything that I have mentioned is not just a Black community thing. This is something that honestly would bring better patient care in general. Now, a couple of months back, I did a little bit of gathering of information, and I created a very small and simple survey where I not only interviewed professionals, healthcare professionals, I also interviewed patients. And the healthcare professionals, they were rather from the Black community or persons of color, but they definitely were providers, particularly nurse practitioners, because I have a lot of colleagues that are nurse practitioners since I'm a nurse practitioner. So I had subjects that were readily available to me. And then, of course, I spoke to people of color who were patients as well. And I asked them a couple of questions, and those questions were, for one, do you feel like your provider listens to you? Do you feel like their staff listens to you? Do you feel supported when you go to the doctor? Do you feel empowered and encouraged? And if you could tell your provider one thing to improve the delivery of their care, what would that be? Okay? Those were the questions towards the patients. As far as the providers, what are some complaints that you have heard patients from the Black community or patients of color have? Now, here's the thing about being a provider and being a person of color. At some point in time, you yourself have been a patient. And so some people were not just drawing from their professional experience. Some people were drawing from, being a child of an aging parent, that they have had to go into the office with their parents, having children, that are patients. We know about the maternity, the disparity amongst Black maternity in this country, and many of them, if not all of them, were mothers, and some of them pulled from that experience as well. And so I really understood. I had a suspicion that dismissive behavior in the way that we communicate is a problem, but I wanted to do this survey, like just a little small research, just to see if I was spot on. And I will tell you, some of the answers, pretty much all of the answers, were pretty much the same across the board. People feel like they're not listened to. People feel like providers don't care, and they feel like they're a bother, they're a burden. There were many patients that spoke about being talked to and belittled, talking down, them being spoken down to, or feeling like they were made to feel not very intelligent. And some people even felt like the doctors were purposely speaking over their head, using language that they didn't know. And they left feeling very insecure, feeling discouraged, feeling like, the issue that I had was not addressed. And as providers, I know that that is not our intent. I also know that we can get very busy in our everyday life. In our clinical workflow, we can be so busy. And we spoke about this a little bit about time and being able to readjust the time in your workflow throughout the day so you do have enough time. One solution that I would like to offer to anyone who may feel like, if I'm honest with myself, I know I can get a little rushed, and sometimes I can be a little short with people, because in essence, that's really what dismissive behavior can look like for a lot of us. And one of the things that has really worked for me to help me build that rapport with my patients, as well as how I have coached other clinicians and healthcare centers, what I have really helped them to do as well is to really implement motivational interviewing. Now, again, this could be a whole conversation on its own, okay? And this is not something that I created. I'm not the inventor or, introducer of motivational interviewing, but it is definitely something that is a great tool in healthcare. And I just wanted to introduce this and just kind of highlight some things that we as healthcare providers can do and utilize within motivational interviewing when we are communicating with our patients. Motivational interviewing is a whole approach. Like, it's a whole way of communicating, right? It really takes in the way that you verbally communicate as well as non-verbally. It really puts you in the seat of more of the listener in helping you to listen to understand and not listen to respond. And I understand that we are so busy in our practices, right? We're so busy. We have so many things that we have to get done within an 8-hour period or however long you work period, that it's hard. And so it's so easy for us to interrupt our patients. It's so easy for us to jump to conclusions to get the ball moving, right? But we have to resist that, and if done effectively, it actually will not take any more of your time. It's a way that you communicate with your patients. Now, a couple of things that I do want to highlight, I'm not going to get off into all the ins and outs of motivational interviewing. I will put some links to some great resources in the description box. But a couple of things that I wanted to highlight that I know can be an issue for us in healthcare is with the dismissive behavior, sometimes we can fail to acknowledge that our patients actually have an issue. We can go and we can jump to the conclusion like, okay, yeah, they're telling me this, but this is really what I'm able to address today, or this is what I'm really hearing them say. Well, that can leave a person feeling like you're not even acknowledging that I am telling you I have a problem. Like, I'm telling you this is my problem, but you have shifted the conversation here. And if you actually switch the tables and think about if you were in their shoes, how would you feel? Also, it takes no time to affirm the patient. Acknowledging what they're doing right. This is a strength-based approach. A lot of times we can talk about where they lack, what they need to get better in, but we don't do a lot of talking to them about what they're doing right. As a parent, as we're raising our children, as we're disciplining our children, I think about this a lot because we're often correcting because we're raising children. We're trying to teach them and help them develop their character. And we often can focus on what they do wrong, but we don't always focus on what they do right. And we can do this with our patients as well. And lastly, the last thing that I want to highlight is our nonverbal communication and really being intentional with our body language, the way that how we show up in front of our patients. Now, it goes without saying, I think we're really good at knowing that nonverbal communication can definitely, give the illusion that we're not listening. You know, if you're crossing your arms, if you're not engaging, if you're not, you know, having an active conversation with a person, that can really come off as being very dismissive, right? And so I want to charge all of us and really challenge all of us to be very intentional with your nonverbal communication as well. Now, again, I will put some links in the description box for some further reading and further resources that you can look into. But I appreciate you guys going on this journey with me. I know that it's different from some of my past videos, but I really believe that we have to start addressing the way that we approach our patients in order to get the outcomes that we anticipate. You know, when it comes to our treatments and our guidelines and our algorithms, those are important. We definitely need to be following them. But if you notice, year to year, much of those standards and those guidelines, they don't change drastically from year to year. There's more of a building upon what the last year was. You know, there's not a whole bunch of new introduction of new ideas from year to year, okay? But the thing that makes the difference is the way that you deliver that care. I really wanted to take some time to actually think more outside of the box in the way that we deliver the care. All right, guys, that's all I have for you. Thank you so much for going on this ride with me. I hope that you have left this month, Black History Month, with more insight on how to better engage Black communities. If you're not already subscribed to my channel, please do me a favor. Go ahead and subscribe, ding that notification bell so you do not miss an upload. Also, if you're over on Instagram, you can find me there at the Diabetes NP. I would love for you to follow me there and also connect with me on LinkedIn. You can find me under Kimberly Ellis, the Diabetes NP. So anyways, guys, thank you all for tuning in. I will catch you on the next video. Bye.